of the Great Lake. Good afternoon, everyone, and welcome to the special radio show with Dr. Doug Thompson. With over 25 years' experience in state of the art oral health, Dr. Thompson will be talking to us about the serious connection between gum disease and most of the major diseases of our time. He'll tell us about where his research has led him with respect to avoiding these silent killers. He's joining us today in this rare opportunity to call in and speak to the doctor directly. And you won't want to miss what Dr. Thompson has to say. If you have a question for him, we're inviting you to call at 800 859 0957. So stay tuned, and we'll be right back after this short break. You're listening to 760 WJR.
Okay, we should be on Facebook Live now.
We are? Yes, we're set
Yeah.
up. We're
Yes.
ready to go. Okay.
Okay.
Dr. Thompson, welcome back. Very nice to see you. We're in Miami and you're in Detroit, but
Yeah.
always glad to connect and hear what's new. So, what are you going to be talking about the show today?
Well, first off, I'm sorry I'm not in Miami. That would be
Next
better.
time,
But
We are
next
too.
time.
but
We're
but
going to
any,
drag
but
you
any,
down next
but
time.
but anyways, yeah, let's talk today about let's just talk today about the connection with heart disease and with dementia and diabetes. Those are maybe the three. I know you
Mhm.
mentioned the words major diseases of our time. Those are maybe the three
Yeah.
big ones that we could outline what the connection's about, and how do we help figure out who has what, and so we can do that.
Heart disease, diabetes. What was the third one?
Dementia, just Alzheimer's and
Dementia.
dementia.
Yeah.
Yeah,
Right.
just cognitive decline.
Right.
So that would be it's a there's a quite a lot going on in that department, and we could talk for hours and hours about those, but maybe a little bit more of the specifics of what the relationship is and how what happens.
Mm-hmm.
That's what I was
Yeah.
thinking.
No, yeah, I'm thinking as you're talking to me, every one of these topics is an entire show or two or three on its own. I mean, you can really go and take a deep nosedive into any of these subjects,
Yeah, and
and
it's yep. And again, as we've said on other shows, we're up to 57 different diseases now that are related to oral pathogens or oral conditions. And
right.
as Siobhan said before, what are some of those? Well, heart disease, dementia, and diabetes are real big ones.
Okay.
So
Welcome to the special live radio show where you can call in with your questions and talk to the doctor directly. I'm your host, Anne Marie Cronin, and we are here today talking with Dr. Doug Thompson, integrative oral health dentist from Bloomfield Hills, Michigan. He's here with us discussing his state of the art clinic, the latest diagnostic systems in oral health care, and the importance of the connection between the mouth and many systemic diseases. If you have a question for the doctor on the matters we're discussing today, please call us directly at 800 859 0957. Again, that's 800 859 0957. Dr. Thompson, always a pleasure to have you on the show. You're just full of all kinds of information about how we can stay well through what we discover in the oral cavity and in your mouth, and what all dentists should be doing, not just you. I'm here with Siobhan Cronin in Miami. We're piping you in Birmingham, Michigan. Welcome to the show again. What is the topic of the day? Diagnosing and preventing these horrifying diseases: heart disease, diabetes, dementia.
yeah,
So,
thank you so much, Emery, for the warm invite. It's nice to be back. I kind of prefer to be in Miami, but I'll do the best I
next
can.
time.
I'll do the best I can with suburban Detroit. Anyways, yeah, the we're up to 57 different diseases now that are related to conditions in the mouth. And what I would say is that in the world of heart disease and Alzheimer's and dementia, these are diseases that happen because our blood vessels are not working properly, or our blood vessels are being affected by what's happening in our mouth. So these are two of the major diseases that we can help patients identify and manage. And then diabetes is another one. Those are only 3 of the 57. We have great research showing that some of the mouth bacteria are implicated in cancer, colorectal cancer, quite a few other things. So I thought it'd be nice to talk about. We have a lot of people that have heart disease or have had a loved one have a heart attack way earlier than expected. Even people that look fit and trim can get into trouble, and many times they have undiagnosed dental issues. And so we would like to help the listening audience understand the significance of being assessed and making sure that the mouth isn't a contributor in a negative way to your overall health. That's what we're really trying to do. I can't totally stop a heart attack from happening, but I can tell you I can take the mouth out of the equation as being a contributor to that disease process. And that's my responsibility as a dentist. And then I have to collaborate with other healthcare professionals to help patients. But Anne-Marie and Siobhan, most people are walking around that have heart disease and they don't even know it. They don't even know it.
Right.
The first time they find out is when they have a heart attack or a stroke, and that's way too
Right.
late. So there's some very easy early warning signs that we can see by looking in the mouth that can help us determine who might be at risk. And then if those people are at risk, then we want to get them to the right place so they can get the right kind of help. So that's an overview of heart disease and brain and dementia. When your brain stops working, it's because it doesn't have a good blood supply or it's getting blocked up, just like your heart vessels do. And if your brain gets blocked up, then you can't think. So what happens with conditions from the mouth? They contribute to the blockage process. They contribute to the blockage process. It's very scientific. It's very sophisticated. It's not such a great thing to describe on a radio, but it's a very sophisticated process. So I know if you have the wrong kind of bacteria in your mouth, your vessels are being affected very slowly over a long period of time. And for a lot of patients, this starts happening in their 20s. We even see young people that have significant issues. So just because you're a young person, that doesn't mean that you're free or that you're exempt from this killer. And it is a silent killer. It happens very slowly over time. And then one day we get surprised with a heart attack or a stroke, and everybody says, "Oh my gosh, I didn't think he or she would ever have a heart attack or a stroke." And so it spares no one.
I think one of the most important things for everybody, for all listeners to know about, is that we have this capability now, albeit that not all dentists are doing what you do, but we have the capability to look into the oral cavity and discover what pathogens are out there that lead to the, future heart disease, cardiac disease, diabetes, Alzheimer's. And I mean, that's relatively new technology, but certainly most people don't know that it's only dentists and dentists like yourself that are preventative dentists that are doing it. And, what an easy solution to get a heads up on where you're heading just by taking a swab out of your mouth and looking at the saliva and looking at what pathogens are in the mouth and identifying which ones are dangerous.
Yeah, and it wasn't that long ago that there was only it was only thought that there was an association, meaning that it wasn't causal, like the bacteria didn't cause the problem in the blood vessel. Well, what we've learned in the last 5 years is that there definitely are changes in the blood vessel wall if you have the wrong kind of pathogens. So we know now it is causal. It's causal of negative changes in the vascular architecture. With vascular is just a good word for your blood vessels, and for the shape of those blood vessels deteriorates when you have bad acting bacteria in your mouth. And what we've become really proficient at is learning how to identify those and then coming up with solutions to help eliminate or remove the insult.
We're going to come back and talk about that on the other side of the break. You also should know that we are on Facebook Live if you want to tune in and hear the discussion over the break on Facebook. In the meantime, you're listening to the Dr. Thompson radio show. He is here with us today talking about the seriousness of undetected oral pathogens. which can be the root cause of many catastrophic diseases. If you have a question, you can call us directly at 800-859. Again, that number is 800-859-0957. Don't miss this opportunity to talk to the doctor directly. And you are listening to the Dr. Thompson radio show on 760 WJR. So we are now going back to Facebook
hmm
Live.
We're back on Facebook Live.
Yeah, so I hope that gives you an overview of where, of where we can go, and it's amazing how many people come in to the practice, and when I look at their health histories, I see other things that put them at risk for heart attack and stroke, and then when we add the mouth component to it, many people have multiple risk factors that can be managed, and we can, and we help them manage other things too. We do some exercise coaching, we do some nutrition, we give some nutritional advice. We can give people other pieces of information that can really help them be healthier. We can guide them and get them to the right place. The people who understand the language. This is not, unfortunately, it's not mainstream medicine. It should be mainstream medicine and it should be mainstream dentistry, but it just isn't. We're learning about it.
Yeah, it's a long way off to becoming mainstream medicine for sure. I think the dentist probably have a better shot at getting that because you start off by looking in the mouth. So you're getting the entryway into where everything is possibly first happening. One of the things I was thinking about during the last segment was what about childhood diabetes? What about the younger and younger people are becoming pre-diabetic and diabetic? And so in the pediatric population, are you able to take a look in the mouth with young people as well and come up with the same results?
Yeah, there's no question, and we should mention it when we go back to the
Yeah,
back on the radio. But now it's recommended that children get their first cholesterol test between 9 and 11. I mean, who would be thinking about checking their child's cholesterol at 9 to 11 years old? That's because
right.
the disease is happening earlier and earlier and earlier. Children with a poor diet are eating all the building blocks that create this blockage in your body, and some of them just live on that, and that's all
Right.
they eat. And so we're getting, our society's getting heavier and heavier, and we're getting sicker. Our vascular health is getting sicker and sicker, and some of it has to do with, obviously there's many components to that, but some of it has to do with nutritional and dietary choices.
Catch it early while you can, but I think it's really important since all young kids do go to the dentist. Okay.
Yeah, a lot of them do.
You also need to talk more and talk about
Okay, I'm feeling there's a
Facebook.
lot of things here. Yeah.
Welcome back to the Dr. Doug Thompson live medical radio show here on WJR. I'm your host, Anne Marie Cronin, and we are here today talking with Dr. Thompson, general dentist and oral health specialist in Bloomfield Hills, Michigan. He's with us discussing the latest diagnostic methods he uses to diagnose many systemic diseases, from cardiac disease to the prevention of Alzheimer's. If you have a question for the doctor, please don't hesitate to call at 800-859-0957. Again, that's 800-859-0957. Dr. Thompson, over the break, I brought up a question about young people, about children, children who become pre-diabetic or they're heading for a life of being attached to that lifelong disease. And since they all go to the dentist, that gives you the perfect opportunity to look into their mouth and find out whether or not they're heading in that direction.
Yeah, there's no question about it. And one of the things that we have to our benefit when patients come into the practice, no matter who it is, a child or an adult, is we have FaceTime with them. We're with them. We're not with them for 6, 7 minutes. We're with them oftentimes for a half an hour, 45 minutes, even up to an hour in our normal hygiene procedures. So there's no question it's a great opportunity for us to look and see things that maybe might not be detected otherwise. But to your point about young people and children, it's now recommended that children between 9 and 11 years old get a baseline cholesterol level. I thought that heart disease, I thought you did that in your 30s or, in your, sometime way later in life that we dealt with this. Well, because
I'm
of
sure
our
that's what everyone thinks. Who would think that kids should get a cholesterol level?
Yeah, well, because of our food choices and because of what's happening to our society as a whole from our some of our dietary choices. Now, there's other things. There's genetics and there's microbiome and there's other things that can contribute to that. But let's just talk about some of the poor food choices that are out there. And these kids live on some of this stuff, which provides the building blocks for your vessels to get clogged up. And so it's starting much, much earlier. It's starting much, much earlier. And so we do see children, and the other problem with children that is a big contributor to overall health and their cognitive ability and their mood and their is a poor sleep quality, and that poor sleep quality also contributes to the degradation of the blood vessels. And so we have children that have poor sleep quality and limited sleep quantity because they just don't spend enough time. It's either they're allowed to stay up as long as they want. They're not scheduled, and so we see some of these kids that come in and then they get diagnosed with ADD and ADHD and hyperactive disorders and different things, and some of that's related to sleep, for sure. So two things about kids that we want to make sure none of our children suffer from. We want to make sure that they don't have the risk factors for early heart disease. And we like to alert parents about good, healthy dietary choices for children. And then the other thing is that they have no issues with sleep. So no sleeping sounds, no snoring, no gasping, no sleeping sounds from your kiddos. If the children are having a hard time sleeping, they need to be evaluated for sure because it's a very dangerous situation.
Dr.
That,
Thompson, I have a question. So when you are doing the swab to test for the different pathogens or the spit test to test for what's going on inside the mouth, are we finding that a lot of the pathogens that lead to later disease might be coming from certain foods or environmental factors? Is there a way to identify sort of the source of where these things are coming from?
Yeah, it's a good question, because one of the things that the disease of caries, that's the disease that causes cavities. We talked about that before. And it's thought that the bacteria originally come from a primary caregiver, somebody who transfers the bacteria in saliva. That's typically how that disease happens. We have in our body a small percent of the unhealthy organisms, but they're held in check by our healthy organisms. So what happens is we get our immune system starts to allow us to create, just like catching a cold or catching any other kind of disease, we start to get an imbalance in the bacteria, and so the bad bacteria outgrow the healthy bacteria, and all of a sudden you have this imbalance. And when you have this imbalance, we have a kind of a fancy word for it called dysbiosis, but that's an imbalance of the bacteria. And you can have an imbalance in your gut, and you can have an imbalance in your mouth, and you can have an imbalance in your nose. And when that happens, we see yeast get involved, and which we can measure for, and we see the bacteria grow to harmful levels. And we know that it's very, very, very small quantities. They don't do any harm, but they do a lot of harm when they're allowed to get imbalanced. So any of these kids with red puffy gums, these kids that their mouth brushes when they bleed, or they smile, and you can see the red band around the edges of the teeth. This is not healthy. This is not healthy. These are some of the earliest forms of disease that we see, and we see it quite often. So we do test. We will test even children for harmful bacteria, and you'll be surprised in the teenage population how many of those kids already have been living with red, puffy, swollen gums for years, and they already have they're on their way to a bacterial imbalance. And the nice thing is, the earlier we can detect it, the easier it is for us to shift it back to one of health. And that's what we do. So it's a nice opportunity, and these tests are inexpensive. These tests are simple. Again, it's either a swab or a rinse sample that we collect. It's swishing for 30 seconds, and we collect the rinse sample. We send it to a testing lab, and within sometimes days, up to just even a couple weeks, we have the results, and then we can make some really smart choices about what we're going to do, if we're going to do anything or what we're going to do for the patient.
And you spoke about the fact that they're relatively inexpensive, and that brings up another issue about why is it that we're not told about these tests? Why is it the PCP, the primary care physician, is not doing these tests? And actually, why is it so few dentists are into preventative medical dentistry? And I think that that's the message of this show, is to let people know that these diagnostic tests are available from a very early age. Children should get them to diagnose sleep apnea, to look and see what kind of pathogens are in the mouth. And we've got the technology, and it's a matter of educating the people to the fact that it's available. And as far as it not being covered by insurance, what are we talking about for the Swish test?
Yeah, the Swiss test is there's two tests that are included in my practice. There's two tests that are included for $375. I do a yeast test and a bacteria test. But we're talking under you could get each of them independent of each other. You could get them for $200. So with all due respect to dental education, the schools have so much to teach us in such a short amount of time that this really has become somewhat of a specialty area, and they might touch on it or they might talk just a little tiny bit about it. But I mean, I've spent 13 years really working with physicians and working with microbiologists and working with other people to understand this process, because the remedy for this isn't being taught in school uh, thoroughly enough for dentists to come out and be 100% competent in this area. So we have to learn it. Just like physicians, everyone's struggling to keep ahead of the technology. It's growing. The science is growing so fast. So I don't want to condemn anybody for not doing it, but I surely want to make sure they know they could be and they should be, and we want to help teach them that, as well as our listening audience. And that's why we take time to do this show. We take time to do this show so we can let people know. And then on the other end of my professional life, I train other dentists to learn how to do this as well. So we could be contacted for both of those things.
Yeah, very important. I know I was thinking about that as you were talking, because you're running the Wellness Dentistry Network, which is national, international dentists all over the country that are following your lead and being what I call medical dentists. And they are doing what you're doing, is investigating the precursors to these dreadful diseases that eventually most Americans think they're going to just get anyway, because of genetics or because of what they eat. There's take a passive attitude that I'm probably going to get sick anyway. But let's come back and talk more about that on the other side of the break. In the meantime, you're listening to the Dr. Doug Thompson radio show, and we're talking about the importance of diagnosing and treating gum disease and how it can prevent some of the major diseases of our time. If you have a question, you can call the doctor directly at 800-859-0957. Again, that number is 800-859-0957. You won't want to miss this opportunity to talk to the doctor directly. You're listening to the Dr. Thompson radio show on 760 WJR.
There was a time when we thought that we would only test or only learn about bacteria profiles for people that were expressing disease. But
Right.
now we know that the bacteria, yeast and viruses are so significant to overall health that we would like everybody to be tested. We just
Right.
we want everybody to be tested, and we think it's just something you should know. You should at least do it once, so you know what the makeup of your mouth is. And here's what I would say. I would say that the better your oral hygiene practices are, and the more diligent you are that cleaning in between your teeth and cleaning the tops of the teeth, we know that population probably has some lower bacteria. So I teach two types of people. I teach dental hygienists and I teach dentists. And interestingly, the dental hygienists, who are the professionals that clean your teeth and that do that work when you go into the dentist, if I took 500 of those dental hygienists and I took 500 dentists, probably the hygienist would have a cumulative bacterial load lower than even the dental group. And if I took the general population, we would have even a much lower bacteria profile than the general population. So the more informed you are and the more you know about what to do, the easier it is to control that bacterial load. So it is education heavy, and it is something that everybody can learn how to do. It's not hard to do it. You just have to spend more time. The average amount of time people spend brushing their teeth is under 30 seconds. And to brush your teeth and to get the bacteria off thoroughly, or to, it takes much longer than that, maybe closer to 2 minutes.
Yeah, but it's interesting because having good oral hygiene or rigorous routine doesn't necessarily guarantee. Like, for example, I've mentioned my husband and I had our oral health checked recently, and we were on polar opposite ends of the spectrum.
Sure.
His hygiene is probably better than mine, and he had all of the offenders of all the bacteria, all the parasites, everything. And had to have a major treatment to take care of it. And you would think it's the other way around because he's very rigorous with how he cleans his teeth. But again, we don't know the source of that. It could have been from anything.
Yeah, and you raise a good point. And I didn't maybe answer your question 100% thoroughly when you asked it. There's not too many foods, unless we're eating bad food. There's not too many foods that will encourage that will bring in the bacteria. But there are foods that will support the growth of bacteria, and there are foods that will support the growth of or the existence of inflammation. So that's important to know. So this is why now we're leaning much more on the nutritional counseling side to a Mediterranean style diet, where we're moving mostly plant-based, small amounts of meat, limiting probably dairy and cheese to just reasonable amounts. We think those people are going to be the healthiest, and maybe more fish if you're going to eat protein, if you want to eat animal protein, more fish. But yeah, it's so the bad acting bacteria can be supported by the wrong kind of foods, and it's like the convenience foods, and it would be a diet heavily laden with red meat protein.
Mhm.
Those diets can be supportive of inflammation, and the inflammation brings food for the bacteria. So that's the interesting part. So
Yeah,
you
really
talk about some
interesting.
of those things as well.
Yeah.
Welcome back to this special edition of the Dr. Thompson Radio Show. I'm your host, Anne Marie Cronin, and we are here talking with Dr. Thompson, dentist and pioneer in prevention from Bloomfield Hills, Michigan. He's here today explaining the medical diagnostic model he incorporates in his clinic to screen many of the catastrophic diseases from cardiac disease to Alzheimer's that through early detection can be prevented. If you have a question for the doctor on the topics we're discussing today, please call us at 800-859-0957. Again, that's 800-859-0957. Dr. Thompson, over the break, and I hope a lot of people are tuning in on Facebook Live because we certainly cover a lot of very important things during the break from the live radio show. But I was thinking about the fact that type of diagnostic testing that only dentists are doing, your PCP's not doing it, and only a small segment of dentists that are what we call medical dentists. And certainly you've got the Wellness Dentistry Network where you can refer somebody calling in. But, we talk about this examining the oral pathogens that are in your mouth, and it's relatively inexpensive. It's not covered by insurance, but think about all the extremely valuable information that you can get out
Well,
of what you're looking at.
it can be life changing, and it is life changing for quite a few people. We know that when we get the bacteria rebalanced, patients will come in and say, "My mouth never felt better. This is the first time my gums didn't bleed when I've been brushing or flossing." And before we went to break, we were talking about this bacterial imbalance that we get. We used to think that just the people that had disease were the ones that needed to be tested. But now we understand everybody would benefit from being tested, so we could look at the bacterial loads in their mouth, because we all have a different susceptibility, or we all have a different a capability of either getting the disease or fighting the disease off. So we were talking on the break about two people that would have similar hygiene practices, and maybe even somebody who does a better job at hygiene could have higher loads of bacteria because of their susceptibility. We see this all the time in families with children that eat the same diet, they live in the same home, they go to the same school, but one child has a bunch of cavities and the other child doesn't have cavities. And the reason why is because there's a susceptibility. So I hope that gives a little bit of clarity as to why we're not all the same and why we can't assume just because we brush our teeth or we floss between our teeth that we don't have an underlying problem. We're getting closer and closer in dentistry as well, that when you look at the bacteria profiles, if they're imbalanced, that we know we can conclusively look you in the eye and say this is causing a problem for your downstream health. We know that for sure. So it's become part of our routine screening. We want to make sure that people have access to the information, and our new patients especially. And we'd love for our existing patients to have the test as well.
And beyond the testing, just to jump in, another service that we talked about over the break that you're offering is coaching. We were talking about nutrition, and you're really giving people a lot of information once you do find out what the profile is. That the lifestyle changes that they can make and some of the things they can implement to actually help, fortify their their system and help support, healthier gums, healthier mouth, healthier everything.
Yeah, and just like many other diseases of our time, your lifestyle significantly contributes to either helping squelch it, quiet it down, or making it worse. And we were talking about dietary choices, and the dietary choices, the simple carbohydrates, and the snack foods, and the convenience foods, and high red meat protein diets. They'll support an inflammatory process, and that inflammation is really welcomed by the bacteria, because inflammation creates leaky vessels, more bleeding, brings more food to the bacteria, so it helps support the imbalance of the bacterial population. So, Siobhan, we could go through several lifestyle things, and I'll just give you a few examples. Poor nutrition supports an inflammatory condition. Poor sleep supports an inflammatory condition. Exposure to mold and pollutants in our environment. We have had a lot of water damage in the Northeast from storms, and think about what the Floridians are going through with all the water damage and mold growth. And so these environmental situations aggravate the stability of these diseases and create more problems. So you're correct. When people are in our practice, we want to make sure that we ask them questions about these other areas as well, because it's unbelievable how many people I will suggest, did you have your home checked for mold, or did what kind of environmental toxins are you exposed to? And it's amazing how somebody will find something and then they'll eliminate it, and then they'll come back and say, I feel so much better. So we do have a lot of lifestyle issues that will support the growth or the sustainability, if you will, of this imbalance. And we don't want that to happen. You asked me a question too about food. Can you get this from food? I want to make the clarification that poor food choices support the growth of the bacteria. You're typically not going to get the bacteria from a food source. That's for sure. And then just like our body architecture, when we think about our body weight, I tell my patients, I kind of joke about it, but abs are made in the kitchen, not in the gym. So
That's true.
it's
Yeah.
it's nice it'd be nice to exercise your way to great abs, but you just can't do it. So we have to be careful with how we process food and what we eat. And it's the same thing with oral disease. If you have oral disease, especially cavities and gum disease, we want to talk to you about dietary choices, 'cause that's going to be important.
I think all of the listeners need to realize that what's in your mouth, we're talking about a Pandora's box here. You can't say that because I eat well, or because I make good choices in what I eat, and because I use mouthwash, that I'm home free. I mean, mouthwash doesn't eradicate, people think it does, but it doesn't eradicate the type of bacteria that you're talking about. And as I said before, it's a Pandora's box. Everybody is an individual. And therefore, I feel as though what we should take from this is everybody should line up and get this test. And the other thing, we talk a lot, or you talk a lot, and many other doctors talk a lot about making good, healthy food choices. But there isn't a warning sign on the food we buy saying, don't eat this because it causes inflammation, which can lead to heart attack and cardiac disease. But Siobhan's waving to me. She's got a caller.
Yeah, if we'd like to take a caller, maybe we can get them in before the break. We have
Hmm.
Jade and Allen Park on the line. Jade, what's your question?
My question is regarding oral lichen planus. I was just diagnosed with it by my dentist, and I wanted to know what the treatment plans were that were available for it.
Yeah, Jade, that's a quite a loaded up question, and I have a. If you contact my office, I would be happy to send you a very most recent research paper on that topic. And most of it's treated with topical steroids and some other rinses, but it's mostly palliative care, meaning care to make you comfortable, because that disease is part of our autoimmune disease, and so strengthening your immune system is going to be part of it, and then managing just the discomfort from the disease. And there's various types of lichen planus. So we would want to, it's a loaded up issue, but I would love for you to have access to the paper, which discusses the different types. It discusses the treatment. It discusses a lot of that. And it really has to be personally assessed before you can determine what's the best way to treat it, because there's different types of treatment for different types of that.
And obviously, at the end of the show, we'll give you the contact information for Dr. Thompson's office and how to get a hold of him. And you should avail yourself of this information that he has to give you. Absolutely.
Yeah, it'd be no cost. I just would like her to have it.
Send out the paper and let the patient know, and then follow it up by getting into the right dental care in the future.
For sure.
All right. Well, we certainly don't have much more time. We're going to break. So let's come back and talk some more about these topics on the other side of our short break. You're listening to the Dr. Thompson radio show, where we're talking about oral health and disease prevention. If you have a question, you can reach the doctor by calling directly 800-859-0957. Again, that number is 800-859-0957. Don't miss this opportunity to talk to the doctor directly. You're listening to the Dr. Thompson radio show on 760 WJR.
One of the things that I've realized is I've read these scientific papers about different diseases and disease entities. And what we've done is we've really put together a nice library of resources. And you'll be amazed how many consumers, just like Jade, you think they don't have a medical education or they wouldn't understand it, but some of these papers can be very, very informative for people. So we do share a lot of literature in the practice. We think that's really important.
Yeah, I think that's great because the fact of the matter is that people are uneducated. How are they supposed to know? I mean, no one knows. One of the big myths out there that we talk about all the time is people think that if they brush and floss and swish their mouth with mouthwash, that they're going to kill whatever is in there anyway, and that's just a pure fallacy.
That's correct. And I have there's a publication in dentistry, two professional publications in dentistry, and I have articles in both of those journals that talk about this whole process. And it's much more sophisticated than what we thought, and it's a great opportunity for our patient population and our practice to be, that we're taking care of them this way. So it really feels it's very gratifying to help people be healthier and be better. And we have patient after patient that when I go in and do an exam after the hygienist is finished, they're healthy and they don't have gum bleeding and their mouth is not contributing. But it's taken us years to get the practice cleaned up and get people educated. But it's really rewarding to work this way.
We did get two callers, by the way, so when we get
we're
back on
waiting
the
for two
air,
callers.
yeah.
We'll take them as
Yeah,
soon as we
just so
get
you
back.
know.
But I just think it's amazing thinking about how long you've been practicing dentistry. I'll bet that when you first started out, you had no idea that it was going to just take this nosedive into actual medicine and the prevention of disease. It's pretty remarkable.
I had no idea, but I have. It's a little funny story. I got into a little bit of trouble in dental school from one of my professors, and he wanted me to come to his office so he could talk to me about what I did wrong in his class. And when I went up there, he had all these microbiological pictures on the wall So we ended up talking about bacteria for an hour in about 20 seconds about what I did in his class. So it was very funny, but it sparked my interest into this whole microbiology world. And he was one of the big founders of the drug metronidazole, which is
Hmm.
we know it as Flagyl. And he researched that hard and how it affected periodontal pathogens, and that's what he did. That was his expertise. So that's a little. Maybe that's where my interest started. I don't know, but it could.
Hmm.
But it was. I was fascinated ever since then with the microbiology of these diseases.
I mean, I think it's tremendously interesting. It's just who knew that, and I mean, even now is the fact that we're very fortunate that you can look into the mouth and take a scraping or take a sample of saliva and then find out that here you've got some serious, deadly disease-causing pathogens that maybe we can do something about it now. But
Yeah,
I
I
was
mean,
just thinking, go ahead.
yeah, and the other misconception is that it's just this is just part of aging. It's just not part of aging.
No,
So
exactly.
it's not normal, right? So it's not
Right,
normal. We used to think people just got old and then they had a denture, but that's not what happens.
right.
2 calls.
I know. Welcome back to the last segment of this special live edition of the Dr. Thompson Radio Show. I'm your host, Anne-Marie Cronin, and we are here today talking with Dr. Thompson about his state-of-the-art clinic and his practice of prevention. This is our final segment, so if you have a question for the doctor on the topics we're discussing today, please call us at 800-859-0957. Again, that's 800-859-0957. Being this is our last segment, and we certainly want to talk more to you, Dr. Thompson, but Siobhan's lining up calls.
Yeah, so up first we have Gwen in Detroit on the line. Gwen, what's your question?
Hi, I'm so sorry. I caught you on the radio, right? But I had to get out of the car. And I know you said you were going to give the contact information at the end of the show, but I'm no longer in the car.
Oh,
I'm just wondering if I can have it early. I'm not in the car.
yeah. If you write it down, I can give you the number right now. It's
Yes, I have it.
248-642-1000 is the direct number
Oh,
to the
thank you
doctor's
so very
office.
much.
Oh, you're welcome.
Thank you,
Thank
Gwen.
you.
Okay, up
Uh-huh.
next we have Teresa on the line from Willis. Teresa, what's your question?
My question is oil pulling, does that make a difference in the bacteria in your mouth?
Yeah,
Oil
Teresa.
pulling with coconut oil.
Yeah, Teresa, that's an interesting question, and the concept was that if you use coconut oil, and if you put enough coconut oil in your mouth to make a small little bolus that you could swish around with, that if you swished with that for up to 20 minutes, actually, it's 20 minutes, that it would affect the bacteria. And what I would say, Teresa, about oil pulling is that the benefit of the oil pulling does come from a little bit of the antioxidant property of the coconut oil, but more importantly, it's the friction that's caused by the oil rushing back and forth between the teeth and on the teeth. So the benefit of the coconut oil is the mechanical disruption of the bacteria just from the aggressive swishing, but you have to do it for 20 minutes. I can tell you how you could do something a lot easier. You could brush for 2 minutes and it'll be over. So I don't think you need to, we really don't need to swish anything for 20 minutes. And in my bacteria studies, I didn't see the benefit from the people that oil pulled and from the people that did that in my practice. Now, I don't have a research studio. I didn't set up a formal study. I just had several people tell me they want to oil pull. And I said, that's great. Let's measure the bacteria before you oil pull for as long as you want, a month or whatever you want to do, 20 minutes a day. And I had people do that. And then we remeasured and there was very little change. So my answer to people is I think that you can spend your time more wisely with a mechanical toothbrush or a power brush or a water pick and and do a much better job in way less time. You also have to be careful what you do with the coconut oil. You have to discard it in a trash can. You can't put it down the sink. There's some other issues with it as well. Shouldn't swallow it. So there's other issues with that as well. And I hope
Well,
that
thanks.
answers the question.
Anyway, coming back, since this is our last segment, what I would like to make the highlights are that I think that everyone should take advantage of getting into a practice like yours and getting this diagnostic testing done. It's very inexpensive, albeit not covered by insurance. But think about the wealth of information that they can get, that anybody out there, any patient, any consumer can get. And it's all about prevention. It's really all about prevention.
Yeah.
And
And
when we
oh, go ahead.
talked
Go ahead.
earlier about, yeah, about, young people and young children and how, the pediatric population, you want to catch it then and not just wait until you think you've inherited the disease.
Yeah, there's absolutely no question that the earlier we can detect it, the better. So so you hit on a very important point, and that's get this figured out early, and then let's figure out how to how to tackle it. Now, one of the other things that happens when we look at the bacteria testing, and just like you're learning today as we go into these, you called it Pandora's box. But when you start talking about these other areas, the education in our practice doesn't just stop with just what do the bacteria do. We really are working with patients in a lot of other educational ways, and the education about again the lifestyle impact and things they can do to minimize this, and uh, it's very important. And we have these discussions for a number of reasons. One, the patient needs to know, but they all have family members. They all have people in their environment that are struggling with some of these things. So we have patients that come in and they leave with sometimes books. They come in and they leave with papers. They leave with a lot of really good information that they can take back and not only use for themselves, but use for others that they care about.
And also, I'm just thinking about the fact that I really feel as though people ought to seriously take advantage of this testing that you're doing because I think most Americans tend to think that if I exercise and I eat well and I eat the right food, and they go a lot by how somebody looks, and it's nothing to do with how somebody looks. Because again, coming back to the Pandora's box, you don't know what's in your mouth. And I talk about this a lot. We talk about this on other shows. The statistics are, according to the CDC, 700,000 people dropped dead of a heart attack last year. The year before, it was like 670,000. The figures are going up, not down.
Yeah, it's
And
every.
here,
Yep.
go ahead.
No, it's every 34 to 40 seconds somebody dies of a heart attack or a stroke. Well, think about all the patients that I could see in a day, and I could help determine who might be at risk, right? That's the idea. So I think that test is just one. It's one aspect of the discovery of how oral health can affect systemic health, but it's a really important piece, and it really is what starts the conversation because it gives us so much insight as to what's going on.
And it's not just, as we said at the beginning of the show, it's not just cardiac disease or diabetes. These are slow moving diseases and organisms that are, entering into the bloodstream and causing all kinds of catastrophic diseases. And
Yeah,
here we've got a really simple solution that doesn't cost that much and can be done very easily and very quickly. It's not an invasive test. You just make an appointment, you go in, you get the saliva test done, and then you find out what's going on that could be dangerous for your future health.
yeah, and this is why, in addition to the test, this is why it's important for us to have a medical history and a dental history, because the other supporting data really helps us create a picture of what's happening. And I can tell you the people that come in and have the saliva test, they should also not be afraid to come in and do it or not feel guilty. Some people, I can tell you that some people feel guilty because they'll tell me right in the beginning, "Oh, I've neglected my mouth." Well, even if you've neglected your mouth, if you don't have susceptibility for disease, you're probably still going to be relatively okay. But these are not diseases of neglect. These are diseases because you're susceptible to it, and you have to find out if that's you. If it's you, then we want to provide some help for you.
I know, and it's just always come back to the fact that I think people should be lined up to get this test for a few $100s. They can come in and get this diagnostic test, and at least it gives them a heads up on what they're susceptible to.
Well, I happen to agree with you, and I would love for everyone to come and get the test and get educated about oral health. It just helps the whole entire population be healthier and reduces the risk of problems in families. And I every time I hear a story about a young person having a heart attack or a stroke, first thing I think about is I wonder what their mouth looked like.
Exactly, or if you could have caught it on time. Well, unfortunately, we're out of time, and that wraps it up for the Dr. Thompson radio show on 760 WJR, sponsored by Integrative Oral Medicine. I'm your host, Anne-Marie Cronin, and again, I want to thank Dr. Thompson for talking to us today about taking charge of our health, being proactive, and avoiding the devastating results of undiagnosed oral pathogens. Thanks also to my co-host, Siobhan Cronin. To learn more about Dr. Thompson's practice, you can reach him directly at 248-642-1000. Again, that number is 248-642-1000, or by visiting him on the web at ioralmed.com. Again, that's ioralmed.com. We hope that you've enjoyed this special show and that you've become more informed about oral health and its impact on the major diseases of our time. Thank you for listening, and be well.
All right.
Great show.
Good.
Yeah,
Good
thank you
job.
guys.